struggle with forgetfulness, or maybe you have some trouble focusing, well, you're not alone. October is ADHD Awareness Month, and to help us understand and find some effective ways to treat it, we are bringing in family medicine doctor Scott Itano with Kaiser Permanente Northgate Medical Center. Hi there, Scott.
Hello again.
Oh my gosh, so this is quite the topic because I feel like you hear ADHD a lot in media, but what is it exactly?
So this is a very trendy topic. ADHD stands for Attention Deficit and Hyperactivity Disorder. So classically, we see symptoms from 3 different categories, whether it's inattentiveness, hyperactivity, or impulsivity. So classic symptoms you might see are difficulty completing tasks, inability to focus, forgetfulness, procrastination, or just, losing items and things like that.
Okay, now some of these are just like, for example, a child's personality type. So, do the symptoms differ with children, or is it generally the same? Are you looking for patterns?
Symptoms absolutely differ from childhood to adulthood. In childhood, boys classically have that hyperactivity component. So they're the ones bouncing off the walls, running around the room, hard to sit still. So you physically see the symptoms of ADHD, and that's why it's easier to diagnose. In girls, they usually have the inattentive subtype. So they have hard time staying on track or focusing, and that's why it's underdiagnosed in girls, because you can't physically see the symptoms.
Okay, so if you have concerns as a parent, as a caretaker, or maybe even for yourself as an adult, when is it the right time to speak to a medical professional?
I love this question because it's always important to come into the doctor at the right time. And that's when your symptoms have been present since childhood, typically before the age of 12. They're chronic, so they last at least 6 months, and then they cause dysfunction. So they cause problems in at least 2 domains of your life, whether it's social, work, or academic. So examples of challenges in different settings of your life are difficulty in completing tasks at work. So you have bad performance evaluations or reviews. Interpersonally, you forget your anniversary or important birthdays, and then you get in trouble, right?
No. Okay.
And so that causes tension in relationships, or you break commitments. And then just personally, you're losing items, you're distracted, it causes chaos in your life.
Oh, for sure. Okay, but I'm pretty curious here because I do know some people who have been diagnosed as adults. I know we're seeing a higher rate of late ADHD diagnoses, but is this something that you as an individual can tell about yourself, or do you usually depend on somebody close to you to say, hey, I've noticed these things?
So it's both. So typically, you might identify those symptoms yourself and recognize, hey, I can't get ahead at work, I can't get that promotion, or I'm getting D's and C's at school and I don't know why. Other times, because of that dysfunction, that degree of impairment, your loved ones are going to notice. Your partner, your friends, your family members, they're going to be like, why could you never make commitments? Why can you never be on time? And so it can happen both ways.
Okay, so another reason this is a hot topic is that you're seeing a lot more people talk about it, right? So are we seeing more of these diagnoses because more people are getting ADHD, or because we just can better identify the symptoms now?
So I think it's hard to say. There's definitely growing awareness, and we are seeing more diagnoses. And we don't know if this is just due to social media or because we're more accurately diagnosing the issue. So for example, in Washington, from 2016 to 2022, we saw an increase in ADHD prescriptions by 55%.
Whoa!
Yet our population only grew by 9%. So we do know there is some overdiagnosis happening, and that's because there's confounding issues. So if you drink alcohol, use cannabis, those are always going to cause symptoms that mimic ADHD, yet are not.
Okay, so we talked a little bit about how there's some medication that can help if you do indeed struggle with ADHD. Are there other ways this is treated?
Absolutely. And what people don't recognize is there's 2 forms of treatment. One is counseling, just learning organizational skills that help you stay on track, live your life better, even in spite of ADHD. And then the classic medications, both stimulant and non-stimulant, and that's up to your doctor to decide.
All right, Scott, thank you so much for coming in today. Yes, I know a lot of people have a lot of questions about ADHD, so we certainly hope that this helped answer some of that, considering it is October, so ADHD Awareness.